It is a lovely evening out there, isn't it? And we are sitting here, no sun shining here, but we have probably a good reason. And we are really happy and moved by every time people come at night here to spend time to think about certain problems, mental health. We are always moved and very, very stimulated by it. This is a part of this series of conversations at the Royal. Maybe some of you attended some other conversations parts, and we try to address the topics that are really important for people, for patients, for families, for everyone, basically. And we have done several talks about anxiety problems as well, and one year there are some colleagues here from our program, and they participated in that. One year we talked about what are the main manifestations of anxiety disorders and how to recognize it. Another year talked about what kind of research is done, what kind of treatments are out there. And when we were thinking about the anxiety, it's we see in our program in this hospital a number of people with problems with anxiety, and sometimes and quite often things go really good and people get better and we are really happy, and this is what we really want to happen. And other times it takes a long time, and sometimes we are not getting the results we want, and we feel miserable and frustrated at times, and we can only imagine or also really relate to how these people who live with this anxiety every day, and their families, and how they struggle, and what it takes to make it another day, and what it takes to make it another certain obligation in their lives, which many people take for granted. And today we thought to address the experience of anxiety, which is often relentless and often kind of interferes with so many things on a different level that it starts ruling our lives. I don't need to preach to the converted here perhaps, but it's often not well understood how common is anxiety. It's understood that anxiety is common, I believe, but it's not understood that what is common is not trivial. It's not like common cold, not something we can just shrug off and move on with. There is a spectrum of anxiety disorders. Some of them are luckily, milder, and people do live with it and struggle with it, but manage. But there are a whole lot of anxiety problems which are much more difficult than that. And at least, in a given year, at least 1 in 5 individuals, which is a huge number if you think about it, at least will have significant problems with anxiety disorders. And in a given year, it's 1 in 10, but in lifetime, over life, it accumulates to about 20, even a higher percentage. So many people will be affected by it, and many families will be affected by it in different ways. The anxiety, it helps always to start even in treatment and in therapy that, it's not like a destructive power. And we are really born to feel anxiety. And this is a picture showing this baby moving along from a desk to another desk, and there's a plexiglass. You can see through, but baby is not even a year old yet, so but smart enough not to go there on this plexiglass. How many of you have been to CN Tower? This glass floor there. Hey, it's not fun. Maybe for some people it is, maybe, but there are not so many adults. So baby doesn't go there because he somehow understands and perceives somehow that height is not safe, and if they put also kittens on this, if kittens didn't go there either, they were staying away. And if they put little ducks there, the ducks just march through because they think they can fly. So they don't have the fear of heights. But the anxiety is something, and fear is something which has a very, very, very basic and very survival-oriented function, and therefore we're born with anxiety, we live with anxiety. To some degree, it's helpful and sometimes life-saving. So there is a good reason to feel anxious at times. And this is just fear about survival. But I like this citation because it is Buddhistic citation. You know, the Gangaji is a Buddhist teacher or something. She's actually from Texas, but you know, practice in Oregon, I believe. But she's Buddhistic. But many people have said something along this line, and it is what often will be a topic in the therapy as well. When you drop under that and experience the fear without trying hard to fight or change it, letting it be, it becomes still. And by the end of the day, you find it is just energy. Energy may destruct, like in hurricanes, and energy may give us power, like in, you know, some kind of electricity. So it is something which is also expressed here. On this is taken from Time, and there was a nice piece about anxiety, 2 phases of anxiety, and you see the energy could be something that holds you back and ties you up, or the energy can move you on. And sometimes it can move you very fast, you know, but not always need that, and it becomes excessive. And also this energy, we think about anxiety as something really basic, life-saving. We fight, flight, freeze. We often have these reactions, but we often have the anxiety on our mind. And then it becomes something else. It's not so instinctive anymore. We think about stuff. And often people with anxiety will tell me or anyone else, I think too much. There is too much in my mind. There is always like, you know, I try to prevent some bad things from happening. And I worry, and I can stop it. That's a worry is like more modern type of anxiety, because we have, you know, in our lives we have many different things to deal with, and relationships and work and this and that and our health, and you know, there's always something to worry about. Worry is not bad. It's our way of reacting to what's happening, what's going on, and our you know, willingness to engage and to catch up with stuff. But when it becomes something about, you know, things that really are not such a big deal, and worry about something we cannot really change anyways, then it becomes just a burden. And what's called generalized anxiety disorder used to be considered as a, you know, some kind of a disorder which is not as serious, and people can, you know, deal with it, and it's just a residual thing after you improve from some major illness. We more and more learn about it, and some of my colleagues here can speak to it very well, that general anxiety disorder actually is very difficult to live with it, very difficult to treat, and it's kind of very difficult to get better. So in Maclean's there was a piece not too long ago, and I found it very good and very, very, very well written about different aspects of anxiety, from genetics to how the society sometimes creates it in people and makes it more of a problem. What makes it difficult to live with anxiety also, it's a complex experience, a complex phenomenon to experience. It is in our mind, in our thoughts, like the worry thoughts. It's in our body, how we feel when we're anxious. Everyone knows that, right? But you know, people usually know these sensations from short period of times under certain circumstances. And while anxious people will have them outside of any, you know, proportionate circumstance, and for most times. So those without anxiety can relate to it if they think, okay, well, when I look out from the, I don't know, 9th floor, I don't know why I think about the height anxiety all the time. I hopefully don't have it myself, but maybe I have a little. So this sinking feeling and the terrifying moment of what if I just jump there or something like that, and how is it to live with it every day? Some of you know that it is something which is, you know, really, really debilitating. So there are emotions, there are behaviors, how we try to hold ourselves out of anxiety-provoking situations, how this becomes additional burden because we just, you know, stop doing certain things. And it kind of permeates through relationships, through family life, through our ability to work, study, and take care of ourselves. So it is complex on different levels. Some people will have more problems in one area and others in another, but it is really and not. Often anxiety is not. It's everything is tied together. I cannot kind of pull it apart. And then in when we speak about disorders, so it all expressed in the fact that anxiety disorders are thought to be, somewhat distinct. There are anxiety disorders which are like panic disorder, like generalized anxiety disorder, like phobias and social anxiety disorder, which form the anxiety disorders, the core anxiety disorders, how they are considered now in DSM-5, which is a classification of all the psychiatric diagnoses. And nowadays, for example, obsessive compulsive disorder, which used to be considered one of the anxiety disorders, is kind of separated from anxiety disorders and given even more kind of a bigger place in this categorization amongst other obsessive compulsive and related disorders. Same thing with post-traumatic stress disorder. It is used to be considered one of the anxiety disorders, but it's long realized that there is more complexity, but more aspects to it. Its mood is affected and different aspects of memory are affected. So again, there is a new category of disorders we know, but they are put together more separately, and these are the trauma and stress-related disorders. So there are lots of diagnoses, and anxiety is not only, anxiety is not very specific to only anxiety disorders, but it also also very frequent in depression, and it's reflected now in classification, a new category as depression with anxious distress, because it means it stresses and emphasizes that depression with anxiety often will be more difficult to treat and will be more severe and more recurrent than depression without anxiety. Bipolar disorder, anxiety is very often a part of the bipolar illness. Think about schizophrenia. Schizophrenia and paranoid psychosis. The paranoia, by definition, is a fear. It's a delusional fear. It's fear unrealistic, what is very much different from the fear that those with anxiety disorders will have. But it is fear, and fear is felt in the body still the same way and creates the same patterns of thinking. So the anxiety is very common across mental health spectrum. And we're talking about anxiety disorders today, perhaps more specifically, but we cannot just, take it out of the bigger context. So just maybe briefly, it's what makes the burden, what makes it up is really prevalence, as we said. It's early onset. It's a pediatric illness. The most people with anxiety disorders will mention to you that I've had it since very young age. And we see a lot of anxiety in kids, which sometimes is okay, they're anxious, they grow up and they become more mature and they, move on from this anxiety. So it's not always illness, definitely, but some kids will remain anxious, or anxiety will come back to them with more force later on. The lost productivity and disabilities, we will talk about a bit briefly later on. It's often underestimated how much impact anxiety has on this. And overall individual and society cost it has been measured, and it always comes like a big surprise, because it's, oh, really? It's such a great burden, such a big cost. Anxiety, that I mentioned already, it's a complex, and just having diagnosis or problems with anxiety is not very common. With more severe anxiety, there will be several anxiety disorders. There will be problems with substance use often, because what is the best anxiolytic in the world? We know it's alcohol. It has been used for that for ages, and it's not something that helps by the end of the day, but it's not uncommon for people to use it to relieve stress and anxiety. Physical health is affected by anxiety one way or another. Anxiety is not directly harmful for physical health, but living with it for a long time puts your body under stress, and there will be consequences. Medications, many people with anxiety will take medications, and sometimes they help a lot, sometimes a little, but as people who live with diabetes or hypertension and need to take medication, it creates certain side effects and certain additional issues with quality of life, expense, and all these things. So there's lots of complexity here. And the barriers, there is a lot, we talk often about stigma, but it's important to emphasize, to realize that often it starts within, the stigma within. I think this is the very important thing to realize, and perception of self as weak and should just try harder and should make this happen. It's not a bad way of thinking. I mean, it's responsible, and anxious people often very responsible, so much. It's too responsible sometimes, but sometimes people put themselves down. They really harden themselves, and they will not accept help, they will not seek help, and they will not open up to others, and they cut themselves off often. And this is a real problem. Plus, there is certain public stigma as in mental health in general. There is this fact of life, the people have certain opinions, and sometimes they just scared themselves of mental illness and would stay away and kind of project negativity. So that happens. But the problem is also that we have treatments, and many people will benefit from them, but also the access to treatment is really difficult. And if I'll tell you, how long people have to wait, and many of you maybe know that, to see a specialist, let's say in our program, you will come and beat me up maybe later on. So it's not pretty, but it makes things more difficult. There are other agencies and other people and other doctors and psychologists and specialists and mental health professionals who can also help people with anxiety a lot, but it's not enough. So I will probably skip the causes because we don't know exactly the causes. We know how anxiety works in the brain pretty good at this time, but some of this is genetic really, but how much is genetic? It's not more than perhaps 40%, 30-40%. It may be explained by genetic factors, but it's far from 100, even not 50. So there are other factors, and where the field is going currently is more like interaction between genes and environment, and certain type of genetic peculiarities. When it is coupled with adverse environment, then it will give a kick to onset of excessive anxiety, let's say. The same for some other mental health problems. So what I wanted to this maybe looks a bit technical, but I wanted to bring this up because often anxiety is considered something that people can handle. It's not a big deal. They still can go back to work after a bit or manage their lives. And when it comes to the ability to do things, ability to function fully in life, in work, family, kids, self, friends, then we often, people who live with anxiety, they know it, but it's not that well understood. And these domains in the boxes are taken from WHO assessment method for disability. And these are main domains of functioning. And just if you think about anxiety with its physical symptoms, with its emotions, with its thoughts and fears, and with behaviors, which is often avoidance, escape, is isolation, and we kind of project like mobility, moving and getting around. So what is mobility like for agoraphobic individual? It's non-existent often. People cannot leave their homes, or can do it only with someone, and it seems to be like, what's the big deal, But it is immensely big deal for people who live with it and their families. Or if we take any of them, like life activities, domestic, leisure, work, and school. Okay, talk about work and school. And we see lots of young people here who drop out of school because of social anxiety, because of just inability to manage anxiety and study and be productive and relate to other people at the same time. So the impact, and we'll hear more about it today for sure, can be considered in the main kind of medical model, and it's very easy to understand if you apply this medical model how different aspects of anxiety may cause really major impairments in any of these areas. And well, it's interesting that sometimes read about experiences of other people, especially if you want to understand. Like, for example, I work in Operations Strategic Clinic here as well at the Royal, and I'm not a military guy. You can tell from far away that I'm not, and how to relate to someone who is breathing and leaving military, and so it really helps to read something or talk, of course, and most I learned from the clients I see, but also if you read something that people like them have written of their experiences, it put it out in the open, and it really helps. And in respect to anxiety, a few books here, you may know some others, but I like this book by Daniel Smith. It's called Monkey Mind. And one of my patients actually told me, you have to read this. You might understand me better. So, and I think I do understand this individual better after reading this. A bit shocking at times, this book. There are certain parts. I don't know how many of you have maybe read it. But it is worthwhile exercise to read this book. And another one, it's My Age of Anxiety by Scott, what's his name again? Scott Stossel. And it's a bit more educational. There's more historical background and different things that how anxiety was thought about throughout the ages, but also lots of personal experience. And there is the book Shy, which is actually kind of light but very touching. A book by a girl from Australia, actually, Sian Pryor. And this book here, I just by chance came across Anxiety by Patricia Pearson, and actually was interested because Patricia Pearson, as I realized, is a granddaughter of Lester B. Pearson. So I thought, interesting. And she's also a writer and a journalist apparently, and it's also a good book. But there are many books. Sometimes also people with anxiety, they would benefit from reading something like this a lot, because sometimes people are afraid of touching the subject. It's like maybe I will start having the same problems as they write about, or somebody else. People stay away from support group or from book or from self-help materials, and those who are kind of able to overcome that they always say, really, I thought it's just me. It's just stupid me who cannot get it and cannot deal with it. But you see, it's someone who is intelligent. He wrote a book and got it published and making some money out of it. So it says something. But look, he or she has essentially same problems as I do. Now there was over time, anxiety has been related to differently. And there was a long era of psychoanalysis, and there is more like an era of medicalization, and there was an era of and still ongoing era of cognitive behavioral therapy and understanding about how anxiety works in the mind and in the brain. And this goes back decades. And Aaron Beck, who is the founder and father of cognitive therapy, who is 93 years old in Pennsylvania, and he's out there. So he said that anxiety occurs then when perceived risk of threat outweighs perceived resources for coping. It sounds a bit technical, but really you can relate to it probably very well. It's the one thing. It's about cognitive therapy. It's appraisal. How you rate, the risk of threat or harm, or what it's going to cost you. It's not exactly the objective factor itself. It's what we make of it. So it's appraisal. And if the appraisal of threat is increased, if it's overestimated, we will be more anxious. And we will be even more anxious if we think we cannot manage, we can handle it. We'll fall apart, we'll go crazy, we'll do something stupid, we'll embarrass ourselves in front of everybody, we'll get illness, something like this, and we feel helpless. Then the gap even bigger, and this gap will be filled in anxiety right there. And this is also one of the authors whom I recommend you read if you don't know yet. It's Robert Leahy, and I was unfortunately away. He was here just a couple of weeks ago. I don't know, Andy, if you went to this workshop, or Kelsey. Yeah, well, lucky you guys, because I didn't. But his books are, I find them very good actually. And one of these books is called, I will show it later, but this is taken directly from his materials, and he has this really head-on way how to define how people make themselves anxious, or how anxiety comes up in their minds, and how to get away from this by doing other things. And these are the rules how to be anxious. So try to detect danger everywhere we go. People with post-traumatic stress disorder will be often just compelled to do that. Just the one client told me today that his spouse calls him a scanner, because he's always scanning for someone behind their back, something's happening. Detect danger, says brain, because then you will be prepared to do something about it. You'll be safe. So try to do that more. There will be more anxiety for sure. Catastrophize danger. Something small, like I'm sweating a little bit. What if I start feeling even shaky in my head? Would I faint? What kind of embarrassment that's going to be? It's catastrophizing danger. Try to control everything, because more you control, the less unknown things are there, the less uncertainty. And uncertainty is perceived by people with anxiety as threat, as something which is bad, although, constantly it's just uncertain, we just don't know it. But if we try to control and make sure that we know everything about everything, it's going to be really stressful and anxiety will be high up. Avoid or escape. I cannot manage it, so I cancel. I don't go to the appointment. I will not go to this family gathering. They start asking questions. Why I'm not working? Why I'm, this and that? Why I'm gain weight? So why I'm taking medications? Why I'm not strong enough to do it on my own? Blah, blah, blah. So I don't go there. I don't take a bus because I don't feel comfortable, because I can't get out. And these kind of things just fuel the basic sense of not being able to handle things. Anxiety will be higher. So for anyone, me, person next door, if we'll try to do these things, we'll become anxious. It's going to be a tough way of live the life. Now, anxiety-free rule book. So these things, many of them are common sense, but change the things in the mind of an individual who has anxiety is not that easy. You cannot just read the book and, okay, I think differently. These thoughts are coming, before you know them, before you think them. They're sometimes what's called automatic, or they come out of certain beliefs we have about ourselves and our world, and it's not easy to change this, because it's deeply rooted and often coming since early on in our lives. But again, it helps to have this reality check. See things realistically, see the consequences for what they are, try out things and see what actually happens. Let go of control. We saw this Buddhistic message there. Let go of control and anxiety will become just energy. Now, for people with anxiety, it's a very hard thing to do. Very hard. It's why it takes, number of hours, number of sessions, even in intensive therapy, to achieve like about 50% of improvement. It's very hard to retrain our minds. It's possible, and many people do it every day, but it's not easy. Embrace your anxiety. It's not easy. But at some point, people arrive to certain realization that I live with it. What else I can do better? There are certain, certain interest and lots of popularity are gaining, like mindfulness-based training and acceptance, commitment therapy, different kind of therapies, which are emphasizing this aspect. Yeah, this is a problem. You have it. There are limitations. What is that you can accept as your new baseline, and despite it, to develop more coping skills and different attitudes towards it. And it is a way of coping. And often with anxiety, we want to get rid of it, and that's not going to happen. It's not going to happen. We cannot get rid of it because everyone has it. And those with anxiety disorders maybe will still have it more than others who don't have it. But they will be able to live their life still worthwhile and make the suffering worthwhile. Now, it's not just, sorry, we don't have a mental health service available. Go to, Amazon and get your books and good luck. But it is something we always do. We look at self-help. We look at what kind of diets out there. I don't know, different people have different interests. How to preserve our memory, something that's just a few books, but just samples. But there are books that are more familiar to us, and we have met with the authors and went to their workshops and really considered them very knowledgeable and accessible. And this is Robert Leahy, gentleman I mentioned already, and his Anxiety-Free book, one of several he has written. This is by Martin Anthony, who is a professor of psychology in Toronto and Hamilton. The Anti-Anxiety Workbook, it's worthwhile reading, and this Acceptance Conditions Therapy manual, which is more geared towards people with anxiety. It has many useful ways of how we can relate to it and how we can shape up our experiences. Now, luckily, in this day and age, people have different venues for where they can interact, they can make groups, they can support each other, they can relate to people who even live in another city, another country. And internet's one of them, and this is just some of the banners of some of the associations. Anxiety Disorders Association of Canada, if you check out their website, you might find a bunch of useful information and certain things you can learn and you can attend. ADAO is Anxiety Disorders Association of Ontario, and they're based here in one of the branches based here in Ottawa, and I think they're doing really great work with their little resources, providing service in the community. Anxiety and Depression Association of America, until a couple of years ago, used to be named Anxiety Disorders Association of America. So now it's Anxiety and Depression. And there are certain reasons to that, and we didn't talk about depression today, but almost 75%, if not almost all of those who are suffering anxiety know very well what depression is, right? And it's not something which completely exists in separation from each other. And some other organizations here. Well, here we go. There is app for everything. Is there some for anxiety? And I don't know much about apps, to be honest, and sometimes hear from people, this is available, that you can do this, and it's interesting. And I looked up, there is a health website called Healthline. And here you go, right? I saw 18 best apps for anxiety 2014. And I didn't have a clue of any of them. And I looked up, because I didn't have much time, some of them, and they just put their tabs here: breathing, relaxation, worry box, and I don't recall what the thing with the arrows is. But if you look up this website, you can check them out. And some of them that I know a little bit more of, it's Mindshift, which is anxiety specific, and it's put up by folks in BC. Who are working with anxiety disorders. Mindshift, you can check it out. And just because I work here, and I cannot miss mentioning OSI Connect, which has been developed by OSI Clinic staff and OSI Clinic network across Canada for those who have operation stress injuries, either ex-members of military, so current member of military, or first responder. Many people who have post-traumatic stress disorder or post-traumatic depression may find this materials useful. And also by the Royal developed Healthy Minds, which is I think very good and user-friendly app, self-help tool, especially for younger people and students. That is a target group. It's not only for anxiety, it's how to deal with academic stress and life difficulties, but lots of it is anxiety too. That's all of a sudden all. And this, it's getting warm here, but my talk definitely was a warm up for the next presenter. And I'm very, very glad that Lynn will be coming to speak to us as a person with lived experience. And I asked Lynn how I introduce you, what I tell about you, and she told me, now I'm out in the open, you can tell everything. But maybe I mentioned just the fact that don't be fooled by size of this lady. She's tough as nails. And she will tell you how she proved it. Thank you. We'll take questions after Lynn will finish this opening.
Well, while they're messing with that, today I was trying to distract myself from getting really anxious for tonight, so I spent the afternoon in the garden, and I was mucking around in the dirt and digging and mulching and planting flowers and weeding bad flowers, and I lost my favorite bracelet. So I retraced my steps over and over and over again and never found it. I think it's underneath a foot of a plant I put a hibiscus in, so it's gone. So much for an anxious-free afternoon. And damn, I hate when that happens. I lost my favorite bracelet. But anyway, hubby might replace it. I have a story that I'd like to share about a little girl, not much older than 3, maybe 4, and visiting a home somewhere with her family, 4 brothers, a sister, mother, father, and she was on the stairs, going upstairs, and all of a sudden she felt this cold, dark, lonely feeling, and she was trying to reach for her father's hand. Of course, the brothers and sisters were all trying to do the same thing, and that all of a sudden, just darkness and fear. And of course, she was just a little thing. And all of a sudden, just like a dream, it was over. And that awful feeling she lived with for her whole life. And that little girl was me many years ago, 1975. So these episodes for me came and went in my life, and I never knew what they were. And when I was a teenager, they came and went more and more often and more severe. And by 15, I had attempted suicide for the first time. I was confused, uncomfortable in my own skin, sad, lonely, and it wouldn't go away. So after a couple of days in the hospital, I was told by my parents and my doctor at the time, a doctor in my little hometown, that it would be best if I just didn't talk about it, kept it to myself, and it was a phase and it would pass. And so that's what I did. I stayed quiet. And that silence would prove to be so harmful, not only for me, but for a lot of people. My grandfather, this is very difficult, so bear with me. My grandfather was silent, and at age 88, he took his life. My cousin at age 42 took his life in silence. A friend of my oldest son at 21 took his life in silence. And so many of us fall into that abyss of silence for no reason. Why do we not express ourselves? When we are sick, sad, we feel emotion every day. Tragedies happen, we grieve, we talk to each other about it, we console each other. We hurt ourselves, people bring us soup and warm drinks, and we suffer from mental illness, and we do it quietly. And I don't know why. But I'm not going to be quiet anymore. And as long as after my teen years passed, I functioned, I got a degree, I went to school, and I did all the things that people did, always carrying the weight of that, that horrible feeling of depression and confusion and sadness, but I did function. I got an education. I worked for 12 years as a preschool teacher. And I was in a very long relationship, 20 years. And I had 2 sons. And by the time I reached my late 20s, after my first son was born, second on the way, the feelings were intensifying. The the spells were getting longer, and they were a little different. I was constantly frightened. I was afraid to move. It would take my breath away. And it's almost indescribable, the feeling. And I'm sure some of you here maybe would suffer from mental illness. You know what I'm talking about. You know what I'm talking about. So those stresses and that anxiety stayed with me. And of course, at the same time, you're trying to function with a mental illness, which at this point, I didn't even realize I had. I was in my early 30s, never knew what was the matter. And every day, all the curveballs that life throws at you, you're living those as well. Deaths and births and joy and sadness. So it was very, very difficult. And by the time my second son came along, it was too much for me to bear. And I was finally diagnosed with chronic panic disorder and depression. And shortly after that, my 20-year relationship ended. I survived that. And I was a single mom, survived that. And but I continued to feel socially inadequate and just not quite where I wanted to be in my happy and satisfied with myself, and just couldn't get past that feeling of sadness and just constantly self-conscious about everything I did. And if I could just please that person a little bit more, they wouldn't be so displeased about me. So I took up drinking. You can laugh, it's funny. I find it funny now. Because I felt like it gave me that added boost when I could socialize with people and talk to strangers and solve the problems of the world, and just, it was awesome. But then, of course, it's not awesome. And we all know that. Your depression is increased, your medication doesn't work anymore, hangovers are brutal, and you still have to go to work, deal with your daily life. So that wasn't working. So I took up gambling. And that was really not fun after a while. Sure, it's great to feel that euphoric, I won a jackpot, but over and over, after losing so many paychecks, it started to become a big, major drag for my husband as well. So just when I thought that I'd reached the bitter bottom of the barrel, I was wrong. I just felt so rotten about myself. All this destructive behavior that I had added to my pot of crap it was fermenting. And so more than once, I would down a couple handfuls of pills, chase it with a glass of Jack Daniels, and start slashing away at my arms and my legs. And still wanting that little bit of comfort, I'd run the bath and lay in it till I fall asleep, and my husband would come home and find me that way. Just starved for oblivion. And that wasn't fun. So at that point, my sons, who were quite young when I was diagnosed, but we learned together, the three of us, and then I met my husband, and we all learned how to deal with my anxiety and my depression together. And my sons they're superheroes. They're awesome support. Always the right words, and come on, Mom, you can do this, you got this. And I kept feeling like I was failing myself and failing them. And finally, they had a little intervention of their own and got me to admit out loud that, yeah, I do need to stop doing this. I'm tired of it. I want to feel better. I have a lot to do. I have two amazing sons, a great husband, a beautiful home, and I want to love it. And I want to love myself and have some self-respect. So at that point, I hooked up with, I had met Dr. Shlik over 10 years ago. And together, I searched out Canadian Mental Health Association in Cornwall. And they showed me how to cope with my everyday stresses and my anxiety and my depression. And it was very simple. It was all the things that are right there every day, the little things that you enjoy in your life, your passions. I love to read. I'm a violinist. I play the violin, gardening, walking, all those things that I enjoy. And every time I'd have a bad spell, I'd do one of those things or many of those things. And slowly my days started to get a little better. I took all the programs available at CMHA. The RAP program, Wellness Recovery Action Plan, is amazing. I took it a couple of times. And the self-esteem program. And I had a caseworker, and of course my visits with Dr. Shlik. And I started eliminating all the negative things in my life, the people that were just blood-sucking and taking everything away from me. I quit my job. It was a negative environment, very toxic, negative people just demanding more and more and more. And I remember one hospital stay after one of these episodes of mine, and my boss come running into the psychiatric ward in Cornwall, and I could hear him down the hall, "I'm looking for Lynn." And the nurse is saying, "Wait, sir, you can't go." And he ran into my room and he said, "When are you coming back to work?" And so I was up and ready the next day. I took a week in the hospital and I went back, but that was wrong. I should have taken the time for myself, and I didn't. And that, I know my mistakes now. I made a lot of mistakes, but I don't have regrets. I would do it all over again because of my kids. I wouldn't have my children, and I wouldn't have learned how to appreciate the small things that we all should take a moment and appreciate. And at that point, one of the things that I started doing was walking. I walked everywhere. I walked miles and every day, and I'd cry some days, most days. And it was very mind clearing. And at one point I picked up a whole bunch of stones and gathered them up, and as I threw each one into the field, and each one represented something really crappy in my life that occurred, or a person that hurt me. And I just used the worst language I could possibly come up with, and I threw it all away. And it was so healing. But so in that time of walking, I thought, I'm starting to feel better. I'm starting to feel on top of my game. And I really want to share this with other people. So I pledged to tell my story and to share it in hopes that other people would do the same. And by sharing their story, maybe heal a little bit in their own way. And at the same time, raise money for the Canadian Mental Health Association. So I pledged to walk 750 kilometers last summer, and it took me a month to do, but I did it, and I raised $10,000 for the local CMA theater. And so in my healing, and as I wrote everything down on a piece of paper just because my mind was so foggy, all the little things, from lighting a candle to having a warm bath to taking a walk to reading in a nice sunny window, all those little safety zones that would help me feel better on a bad day. And I still use that as a guideline. Mind you, I'm pretty on top of things now, but I still have bad spells, and they're crappy, I have to admit. But I was so pleasantly surprised by the amount of support and positive response I was getting from people I knew, people I didn't know, leaving me cards, letters, donations at my doorstep, on my walk, stopping to shake my hand or ask me some advice. And it was very, very inspiring. And I was so pleased. So that was my adventure last summer. Of course, my husband's always, man, for better or worse. I couldn't have picked a better man. But the amount of support that you may think is not out there, it is. And the only way I feel to get the support that you need and is to educate everyone. The only way you can educate anybody is by telling them how you feel. Somebody can't guess how you're feeling. Nobody guessed how I was feeling. I should have expressed myself, but shoulda, coulda, woulda. It's all in the past. Yeah, being silent doesn't help anyone, and I don't know if I can express more deeply. Don't be embarrassed. It's an illness. I have an illness. Like a diabetic is ill, somebody with cancer. It's an illness that needs to be treated. And I wanted to be treated. I needed to be treated. And so if any of you here know somebody who's suffering, or if you yourself suffer from mental illness, the next time you have a bad spell, think of me, how I had reached the bitter bottom of the barrel, and I'm in such a good place now. I'm in a better place that I never thought I would reach. And I'm truly grateful for the strength that I found within myself, and the power of the support of the people around me, because it is there. And so with that, I wish you every single day filled with sunshine and smiles. Thank you.